Performing a PICC insertion with the C3 Wave device. Open the app by tapping the C3 Wave icon on the iPad's home screen. Tap the New Procedure button. Tap the Patient ID field and enter an ID. You may also enter notes if desired. When finished, swipe the screen upward or tap the keyboard icon near the bottom right corner to reach the Begin Procedure button. Begin preparing the patient hub by plugging in the ECG snap leads according to the color coding indicated. Attach the ECG electrodes. The hub can be placed either on or next to the patient. It simply needs to be in a location that allows the leads to reach the patient's chest. Turn on the hub by pressing and holding the power button only until the light turns on. Please note, if the power button is held down too long, it will unpair the hub's Bluetooth connection with the C3 Wave app. Tap the Begin Procedure button. Visually assess whether the patient has a healthy P wave. Document the healthy P wave image by tapping the camera icon. If you need to better frame the image, press and drag the snapshot window. Then tap Accept. Enter the surface measurement. This is an approximate measurement of the entire catheter insertion track from external insertion site to the SVC. Use the tape measure included in your sterile kit to take this measurement on the surface of the patient's arm and torso. Enter the measurement and tap Accept. Note: if your technique is to measure after setting up the sterile field, this step can be done using the remote. Now begin your sterile procedure as you normally would do. Please note, the following steps simply show how to use the sterile items and are not a true representation of the sterile field. Open the sterile C3 Wave accessory pack. The first sterile item is the window drape. Place the plastic window over the patient hub. The second sterile item is the remote cover. Note: while sheathing the remote, be mindful not to press its buttons. The third sterile item is the ECG clip cable. The barrel end plugs into the hub's post. The other end clamps onto the catheter's preloaded wire. In the event the remote has a low battery, simply select Dismiss to remove the error screen. Using the remote, highlight the app's surface icon and press OK. This shifts the app from surface mode to internal mode and generates the ECG wave based on the PICC lead. Note: in internal mode, the color of the ECG wave changes to white. As the catheter tip gets closer to the SVC, the P wave will grow higher in amplitude. When the tip of the catheter is even with the SA node, the ECG wave will display a negative deflection on the leading edge of the P wave. Using the remote, take a snapshot to document the negative deflection. If necessary, slide the snapshot frame by pressing and holding the right and left arrows. Then select Accept. Enter the internal measurement. This is how many centimeters of the catheter are inside the vessel. Slightly retract the catheter until the negative deflection is gone and only the maximum P wave is observed. Using the remote, take a snapshot to document the maximum P wave and enter the internal measurement. The C3 Wave app allows you to take as many snapshots as needed, but 3 main snapshots should be documented. First, the surface snapshot showing the patient is in normal sinus rhythm. Second, the negative deflection. And third, the maximum P wave, which correlates to the lower 1/3 of the SVC. Using the remote arrows, select the Finish button. This is the last function of the remote during the sterile procedure, and the Finish screen can stay open until the clinician is ready to continue with the app. Read through the bundle protocol to further assess how the procedure went. Answer the question by selecting either Yes or No, and tap OK. The saved procedure will then appear in the app's File Manager window, with the snapshot images displayed on the right. From here, you may print the chart sticker, or upload the snapshots directly to your EMR. Tap Home to return to the app's home screen.